So Audrey, with our patient.
The reason why I decided to be a nurse is because I love taking care of people. It's my passion. I feel like it's my calling here on earth. Just talking about it brings me so much joy, and it's my own way of serving humanity.
I think our overall program is excellent because as you come in as a freshman, you get to start with your very first nursing class. It has to do with the parasympathetic nervous system, which we'll learn about. I think our small class size aids in the faculty being able to connect with the students and teach in a more one-on-one basis.
Your first semester at Wilson, you are in the Nursing Resource Center. You learn how to take vital signs, things like blood pressure, heart rate, respiratory rate, and you really just learn the basics.
So what would you be listening for with her lung sounds?
Before you actually get out there into the field, you practice certain skills and they make sure you're ready, so it's not very intimidating.
And then second semester, you go into real clinical. They really throw you right into it, but I am very grateful for the experience.
What's she getting through her IV site? Wilson is passionate about engaging the students in the clinical learning from the early stages of their education because we feel like it inspires our students.
I like getting out and working in the hospital because it helps me think critically and it helps me apply whatever I learn in class.
At Wilson, we actually offer a 3-year or a 4-year pathway to your end outcome of becoming a bachelor's prepared registered nurse. It's the student's choice. Some of the advantages, students want to learn, get out in the real world, and practice. They have a timetable in mind. They want to do it in the 3 years. We help them plan their courses throughout the 3 years. We have other students who want to do it more in the traditional time frame of a 4-year. So we are supportive of both 3 and 4 years. We determine and advise the student which we think is best for them.
Working with faculty here is really amazing. The attention they give me, you don't feel like a number. The small classes help because with less people, you get more interactions from your professors, so I like that.
There's a special relationship that faculty has with the students. We know them. They're not just a number sitting in a classroom.
I feel proud to be a nursing student at Wilson. Wilson, I think, goes along the lines of you should apply things while you learn them, and I think that that's a really good thing to go by because I can definitely tell you that I have learned so much from my clinical experience already, and I'm just excited for the future of it, and I feel very prepared.